I'd like to welcome you out to the Salem Fire Department fire training for April of 2020. For today's topic, we're going to be talking about infectious diseases, and in particular about the COVID-19 or the coronavirus, which is currently a pandemic worldwide. Here in the U.S., is the #1 leader as far as the number of people that are infected with it. The number of deaths in the U.S. has not topped the highest number in the world yet. Other countries still hold that, but shortly you can expect to have the U.S. probably reach that same number of deaths in other countries, if not pass it and exceed it. Because of how the coronavirus transmits from person to person and how deadly it can be, it's important for us to understand what our role is in the fire department when we respond to calls and possibly encounter patients that are infected with the coronavirus, what we can do to protect ourselves, which ultimately protects our family and those who we come in contact with. So to start off, we're going to take a quick video here and see a little bit more as to where the coronavirus came from, what it is, and how it's kind of developed. And then after we see the video, we're going to get a little bit more detailed about how that affects us here within the department.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
All right, so with the coronavirus, this is a brand new virus that has spilled over to the human population from animals. It's only about 5 months old. It was in December of 2019 when the first cases first appeared in China. So they're still learning a lot about the virus as it progresses and the numbers associated with it. For example, the mortality rate in the video was stated that they had no idea what it was. At this time, it's anywhere from approximately 1.4% up to 5%. As the virus progresses and spreads around the world, those numbers will solidify and we'll be able to tell a little bit more how deadly the virus actually is. Just to give you a comparison, the flu has a mortality rate of about 0.6%. So it is a lot more deadly than influenza, but we just don't know how deadly it actually is until this whole thing passes over. So in the video, they talked about some of the signs and symptoms that are associated with it. We will cover those a little bit more in depth later on, but we need to understand what the hazards are that are associated with the coronavirus. By understanding these hazards, we can learn what we can do to mitigate the risks that are involved with it. So the hazards that we need to take into consideration are the following. The virus itself has been detectable in aerosol forms for up to 3 hours after it has been released from an infected person. It's up to 4 hours after the droplets land on a surface if it's on some type of a copper surface. If the droplets land on a cardboard, it can be up to 24 hours of the virus still surviving. And if it lands on any type of plastic or stainless steel, it can be up to 2 to 3 days of survival with the virus, to where if you brush up against it that has been contaminated, you can then transfer it to you. So the hazards associated with it is we see that the virus itself can survive anywhere from 3 hours up to 3 days, depending on the type of surface and circumstance that it is in. So it's a pretty long time that it will survive after someone sneezes or coughs and puts those droplets on some type of surface. So what does that mean for us? It means that it can easily be spread by first responders. The thing that we need to be concerned with as first responders are the things that we come in contact with in our possession to the patient itself or any of these infected surfaces. So we need to take a look at the vectors of transmission that we as first responders may pass the virus on to ourselves or to others. There's going to be things such as our skin. If we have any exposed skin, when we have any type of patient contact, that can be a problem for us. The gloves that we're using, we need to make sure we're using proper techniques to put them on and to take them off. The medical equipment that we use to treat the patients, to handle the patients, those become infected. Any type of discarded clothing, whether it's our own clothing or the patient's clothing. And medical waste. The PPE which we use will become a medical waste and be considered that when we are done using them and we dispose of them. This can also include any other devices that are used for treatment of the patient while on scene. And we need to be aware of that all of these things are going to be our high priorities for vectors of transmission of the disease. Now just remember that these devices can be contaminated from hours up to days after the droplets land on the equipment. So just be aware of that the clothing you're wearing can be infected after a call, and anything else that you contact after exposure now can be a source of infection as well. So just be aware that it's not just the equipment that we take in and on scene, it's the equipment that we're wearing, the equipment that we take out with us when we get into the apparatuses to return to the station. That can now become infected, and it's just a chain that the virus will follow. So just be aware of that. So what does that mean for us as the Salem Fire Department? As the Salem Fire Department, we respond to calls and assist the Salem ambulance crews. There's always the potential for exposure. Be aware that it may not just be a medical call. It can be any type of call that we respond to, and there's any type of human interaction. So to help us reduce this exposure risk, we have steps that have been set up for the Salem Fire Department personnel and all first responders. So this will include the ambulance crews, also the police officers as well. The Salem City has come up with regulations and directives for first responders within the city, and these are the directives that we need to follow. Chief Ely sent these out to everyone on the department on April 1st by an email, and in that you're going to find the Salem City regulations and directives as it relates to the COVID-19. We're going to cover and clarify how to implement those guidelines while on calls and also at home. So the information we're covering is not only for when you're responding to calls, but you can use it in your daily life to help protect you, your family, and those with whom you come in contact. So the Salem City directives, these are applying to all public safety employees, fire, ambulance, and PD. So these are the measures to help keep us healthy as we serve others in our community. There are some additional resources to help educate yourself, and they're listed within those directives. They have direct links in their directive that Chief Ely emailed out, and they are the EMS Infectious Disease Playbook, the risk assessment, and updated guidelines for medical transport. If you're curious about a little bit more detailed what we're going to be covering here, you can always open those up and read through them, and they do have some really good information in it. So I would highly suggest that you do click on those links, open them up, and read them. It's some really good reading to help us understand how to mitigate the risks and to protect ourselves. So public safety personnel COVID-19 task force has been established by the city of Salem, and this is the group within the city that is going to be monitoring any one of the city's employees if they do contract the virus, and to make sure that they don't pass it on to other workers within the city, and to also make sure that the appropriate steps are taken place to make sure that everyone is safe. On this list, for the directives, if you do have any questions, there's quite a few people you can contact. Chief Ely is always available to answer any questions. You can respond to any of the fire captains as well, or any of the contacts that are listed in their directives. The main contacts in the Salem City directives are Jeff Nelson, Heather Brindley, Chief Brad James, and Mayor Kurt Christensen. All these phone numbers can also be found in that directive, that was emailed to us by Chief Ely. So it's a good resource to have. Now, we're not going to be covering all aspects of the directive here in this video, so it's a good thing to pull that up and read it in its entirety so you can fully understand. Be aware, though, that the directives are a little bit more pertaining to employees, in particular full-time and part-time employees of the city, and some of the city policies associated with that. They do affect us as volunteers, but not everything does. For example, we don't have any of the benefits associated as being a full-time employee, so there are some differences as far as what you're going to do if you do become infected, but there's a lot in the guidelines that you are required to do even being a volunteer on the fire department as well. So what are the steps that are being taken to reduce our exposures as first responders here within the city? This all starts with the dispatch center, and when they first receive a call for assistance, They are set up to have questions answered by the caller to determine the possibility if that caller is showing any signs or symptoms and maybe a risk factor for the COVID-19. So this has actually been established by the state and has been given approval for all public safety answering points, which are dispatch centers, to ask these questions to callers. If the patient or the caller is determined to be a risk for possibly being infected with COVID-19, this information will be passed on to responding units to advise them that the patient is suspected of having the COVID-19. So what are the questions that are being asked? What they're looking for is they're looking for known symptoms of the illness, which include fever, difficulty breathing, cough, and other mild respiratory issues such as sneezing. They're going to ask, have they traveled in the last 14 days? And if so, where? Was it out of state? Was it out of country? Was it to a known hotspot within the state? And they're going to ask them if any of the following symptoms are present. Do they have a body temperature of over 100.4 degrees? Do they have a fever, such as are they hot to the touch and a room temperature setting? Do they have chills? Are there difficulty breathing or shortness of breath? Do they have a persistent cough? And any other new respiratory problems, such as the persistent sneezing, wheezing, congestions, etc. And these are the questions that they're being asked. Now, if 3 of these are answered yes, that is when dispatch is going to be giving us the heads up that they may be COVID-19 infected. Now, just be aware, a lot of these same symptoms are also the same ones for the influenza and flu, which is also going around at this time. With that in mind, there are other centers that will be available to direct the patient to see if they need to be tested for the COVID-19 and to find out if they are actually positive. So the only true way to identify if they do have COVID-19 is by running a specific test for the COVID-19 virus. So these dispatch questions, they'll identify the symptoms with the callers, and the pre-arrival information may contain the following, which we have just previously discussed: persistent cough or respiratory distress, fevers, malaise, which is just general sickness, history of recent travel, and one thing that they may not ask that you want to keep in mind is any type of abdominal distress or a gastrointestinal bleed. So be aware, dispatch may not ask that question specifically, but when symptoms, the signs and symptoms are being handed out by the patient under evaluation by the first responders, that can be one of the things that we identify. So dispatch will notify the first responders of their findings with a call taker, and all responders are to use infectious disease protocol if a positive screening is found by the dispatch center. So be aware, dispatch may be asking the questions if the caller doesn't report. The dispatch may not ask the questions if the caller doesn't report issues of being sick. Remember, callers call in for multiple things: car accidents, fires, brush fires, lift assists. Just because they're calling in for those doesn't mean that the dispatchers may ask the COVID-19 questions. What that means to us is if the questions are not asked and dispatch does not give us a yes or a no as to whether or not the call taker is positive for the COVID-19, that means we need to be asking these questions and asking them from a safe distance. So be aware that we may not be responding on medical calls to be exposed by COVID-19 patients. It can be any other type of fire call as well. So for EMS and fire crews on scene, there are certain procedures in which we need to follow that have been established by the city and also other federal agencies. So how do we handle a patient suspected of having COVID-19? If it's a positive screening for the patient on dispatch, or if we determine it prior to making full contact with the patient, only one EMT is going to enter the home, that means the structure, and no police officers or rescue personnel will enter the scene. The one EMT who's going to be entering the scene will be following the PPE guidelines, which we are going to discuss here shortly. So the highest risk locations that we can put ourselves into with this pandemic is actually inside the structure where the patient is at. So the last place to be is in the patient's own environment unless it is absolutely necessary. So for this, we're not going to be sending anyone in until we have discussed and looked at all the risks that are involved with it and making sure that we are completely protected by using PPEs. The easiest way to overcome this is most patients, they're going to be ambulatory. All we have to do is get the patient to come outside for the assessment. This is a huge advantage by having them come out of the location where they've been sitting, coughing, sneezing, touching all the surfaces, to an environment that is a lot cleaner for us, that the patient will not have been, and they may not fully like it, but if we can get the patient to come outside, it's a huge advantage for us. So the threat of COVID transmission diminishes once the patient is outside in unrestricted atmospheric air. The air moves a lot more, they're not touching a lot of the surfaces outside, so it diminishes dramatically by having the patient come outside. Any ambulatory patient should be assessed out in the open air whenever possible. Now, not every case is the patient going to be able to come out. They may be too sick to be able to walk out. In those cases, one EMT is going to go in, do the initial evaluation, and determine whether or not we need to bring other personnel in. So a patient assessment can take place from 6 feet away to limit the spread of droplets. This is not only outside, but this is also inside as well. As we go inside, we do not need to get right next to the patient and touch them. We can do our initial assessments from the doorway and with a minimum of 6 feet away from the patient. So we want to make sure that we're limiting the time in the patient's environment as well as limit the close proximity interactions with patients who do not require life-saving procedures. We'll talk about one specific life-saving procedure, CPR, a little bit later on in the video. So if we have contact that is required to be with the patient, PPEs must be used. Anytime we're going to be touching a patient, we have to have PPEs in place. So what are the PPEs that are advised from the city for us to wear for the COVID-19? Starts off with a thorough hand washing, both before and after patient contact. So if we're responding to a call, this means if you haven't washed your hands right before you got on the apparatus, we need to get some alcohol cleansing agents and use that to wipe our hands and scrub our hands. The next thing is we need to put on an N95 mask for first responders. Now it has to be an N95 mask. The next thing we'll place on is eye protection. Then we'll place on a fluid resistant gown and some gloves. Now within the city directive, it also mentions foot covers as well. So the question now comes up is, where do we get these PPEs from? The ambulance has all of these. If it becomes necessary for us to have these on the fire apparatuses, we'll see what we can do to get some and place them on the fire apparatuses as well. One concern I have with the fact that the PPEs may be in the ambulance, where does the patient go? To the ambulance itself. So we'll consider whether or not we need to place PPEs on the fire apparatuses if we're going to be having any type of direct contact with the patient. So that will be discussed later on, and if we do have them placed on the fire apparatus, we will let you know of that. Okay, so there's a lot of people on the fire department that are not emergency medical.
This is Katrina, and she'll be demonstrating
show you
the donning procedure for coronavirus.
how to put the PPEs on.
First, do hand hygiene using hand sanitizer or soap and water for a full 15 seconds. Next, don your gown, fully covering your torso from neck to knees, arms to end of wrists, and wrap around in the back. Tie the gown at the back of the waist. Next, don your mask or pamper. You may use a procedural mask or an N95. For the procedural mask, place the ear loops behind your ears. Make sure the bottom of the mask is hooked under your chin and above your nose, and smooth the top across the bridge of your nose. Don't pinch. For the N95 mask, place the mask on your face, covering your nose and mouth. Pull the bottom strap up and over the top of your head and place it behind your head below your ears. Then take the upper strap and put it behind your head toward the crown. Mold the nose piece of the mask over the bridge of your nose to obtain a tight seal. Perform a quick fit check to ensure there is a good seal against the skin. After securing your mask, place your eye protection over your face and eyes and adjust to fit. When donning your gloves, extend to cover wrist of the isolation gown. Upon completion, eye protection should be over your face and eyes and adjusted to fit. Your mask should be covering your nose and mouth with a tight-fitting seal. Gown should be covering from neck to knees and tied in the back. Gloves should extend to cover the wrists of the isolation gown.
Now, one thing to remember that the PPE which we have may not exactly look like the one in the video, but the process for putting it on is pretty much the same. We want to make sure that we have the N95 mask, some glasses, a gown, some gloves, and in the city it also states the foot protection as well. Now we're going to take a look at a video that shows how to take the PPE off correctly to avoid contamination as we take it off.
Doff your PPE at the doorway before leaving the patient room or in the ante-room. To remove gloves, grasp the outer edge near the wrist and peel away from your hand, turning the gloves inside out. Then perform hand hygiene using sanitizer or soap and water. To remove your eye protection, grasp ear or head pieces with clean, ungloved hands and lift away from your face. Then peel the gown away from you, starting from the neck and moving toward the shoulder, turning the contaminated outside toward the inside. Fold or roll into a bundle and then discard. Remove your respirator outside the room after the door has been closed. First, tilt your head forward, then using two hands, grab the bottom strap, pull to the sides, then over your head. Next, use both hands to grab the upper strap, pull to the sides, and over your head. Keep tension on the upper strap as you remove it, which will let the mask fall forward and dispose of the mask. Finally, do hand hygiene with hand sanitizer or soap and water.
So when you're taking PPEs off, one of the most important things to remember is any outside surface can touch all other outside surfaces. Any inside surfaces can touch inside surfaces. The way I look at this is the outside of the gloves can touch the outside of the gloves. The inside of the gloves, which we find what? Our hands, can touch whatever's on the inside of the gloves. Same goes for the gown and the masks as well. So when we're taking the gloves off, you can touch the outside of the gloves to the outside, and the inside, which are your fingers, your hands, to the inside of the gloves as you peel them off. And think about the same thing with the gown and the masks as well. So the next question is, when do we use PPEs? Patient care attendants must stay in full PPEs while providing care on scene, in the ambulance, and in the hospital while next to the patient. So anyone who's going to be touching the patient has to be in full PPEs. For the rest of the ambulance crew, if we're riding in the ambulance, driving them in the front seat, we still need to have a certain amount of PPEs on. We do not require the full PPEs, but we must remove most of our PPEs if we want to, but we must wear the N95 mask at a minimum while transporting and in the ambulance without any direct patient contact. It means we're in the front seat someplace. I would also suggest replacing any type of gloves and putting new gloves on as we're transporting. And it's not a bad idea to keep your eye safety glasses on as well. They're clear, you can see, and it's just an extra form of protection. But the minimum, if we're in the front seat of the ambulance, is the N95. If we are anywhere in the back of the ambulance with the patient, full PPEs must be on. Now, let's take this a step further. If we are assisting with the stretcher, we're in contact with the patient because the patient is touching the stretcher. That means we have to be in full PPEs to assist with the stretcher of loading and unloading the patient as well. So keep that in mind. It's not okay to touch the stretcher with just gloves on. You have to have a gown, you have to have eye protection, you have to have a mask on. That is what is going to be required to touch the stretcher with a patient on it or after the patient has been on the stretcher. Do not touch the stretcher at any times without these PPE precautions in place. So after the patient, what are the guidelines that we need to follow? Proper disposal of the PPE is always a must. Aggressive hand washing after we dispose of those PPEs. We need to then decontaminate all equipment that came in contact with the patient or entered the house or the structure where the patient was. We also need to think about vehicle decontamination. This is not only for the ambulance. If fire crews assisted with the stretcher, touched the stretcher, touched the patient, touched the equipment that touched the patient, and then went and got into the fire apparatus, that has now been contaminated and needs to be decontaminated as well. So when we get back from a call, all of these procedures need to be done if they have not been performed already. We cannot put that apparatus back into service until it has been fully decontaminated. So what we can do to help limit the amount of exposure for people, personnel, equipment to it is to do reconnaissance and triage of each and every scene. We're going to limit the number of persons and the amount of equipment entering a potentially contaminated area, which will help decrease the risk of contamination. So how do we reduce the risk? Number one, let's get the patient to come outside or to the door whenever it's possible. If the patient cannot ambulate, one medical personnel in full PPE should enter the scene to triage the patient and to determine the resources needed. In most cases, we can find that one EMT can handle the majority of the scene by themselves and get the patient outside. Minimal equipment should be taken in by one EMT. Think about what the situation is will dictate what equipment needs to go in. Do we need a bleeding control kit? Do we need to take a mask in for the patient? The very first thing we want to do if we're going into the structure, we need to take a surgical mask in and place that or have the patient place it on themselves. This will help to stop the spread of the droplets by the patient. The mask going on the patient does not need to be an N95 mask. A surgical mask is sufficient to be placed on the patient. We're just trying to stop the spread of droplets by the patient. The EMT needs to determine what resources are needed, and we can discuss this with the EMT by radio, by staying outside and talking to them through the doorway. But we always need to keep in mind that we want the minimum number of resources to be sent in to assist for the needs that are required. Minimal exposure to crews and equipment is the overall goal during the reconnaissance and triage phase. General equipment to consider on these calls are going to be a majority of medical equipment. Do we need a bag valve mask? A big one is going to be the pulse oximeter, the SpO2 device. Pulse oximeters will indicate quite a few different aspects of the patient's condition. Lets us know if there's a distal pulse, which means they have an adequate blood pressure because they'll have a systolic pressure of at least 90. Gives us the O2 saturation. If it's greater than 94, then they have good saturation, which means that their respiratory problems aren't as severe as they may be saying. Gives us what the heart rate and the regularity of it can be, and it's also a very small piece of equipment which is easy to decontaminate. Need to think about a thermometer to see if they have a fever, smaller device again, and we can easily decontaminate that one as well. So what about the more severe medical cases? When these arise, it does require more hands on deck, and that means more potential for exposure. So if a patient is found in cardiac arrest, the triage provider will call in additional resources and initiate compressions-only CPR as per the AHA guidelines. Now, the compressions-only CPR is extremely important because if we start to do any type of rescue breathing, we are now exposing ourselves to the droplets that are coming from the respiratory tract. Compressions only will supply adequate supply of oxygen, and we do not need to supply the ventilation at that time. More advanced airways really need to be considered as far as what you're doing. Any type of intubation, you want to look at the type of devices that you do not need to get next to the patient to actually place those in. We can use OPAs, NPAs, and there are a couple other devices out there such as King's Airway that will help and do not require us to get right next to the patient's mouth. So the objective of this procedure is to decrease the risk and limit exposure to all non-essential personnel until patient viability or signs of obvious death can be confirmed. With the resuscitation equipment during CPR, we need to make sure that we are bringing in all necessary equipment to perform the actions required. So all personnel that are going to be assisting with the resuscitation efforts must be in PPEs before entering the scene. If there is a slight delay in putting the PPE on, that is okay. Our safety and our health is number one over the patient's. The additional equipment that may need to be brought in will be the AED, the oxygen equipment, suction unit, and also a portable transfer device, whether it's a people carrier, the stretcher. Let's think about limiting how big the equipment is and maybe bringing in a stretcher or a Stokes basket, whatever will be the least amount of equipment bringing into it. As we are performing CPR, we need to think about the viability of the contagious person. Are they going to survive or not? If they are not survivable and they pass away on us, we do not transport that patient. All we're going to be doing is, if we do transport, we're going to start to jeopardize the safety of those staff members and healthcare workers at the ER. We're also going to be affecting anyone else that may be at the ER. We're going to put ourselves at a greater risk. And by transporting someone who is not viable, this is of absolutely no benefit to the patient or their families. So when is a good time to stop CPR and actually call it as if they are not viable? According to guidelines that have been done, it is suggested that after 30 minutes of CPR on scene with no return to spontaneous circulation, additional efforts are likely futile. It is okay to stop CPR and call someone as deceased after 30 minutes of resuscitation devices have been confirmed. And also we can look at the heart and see what the actual rhythm of the heart is to help us make that decision as well. So we do not want to be transporting patients just because we're doing CPR on them. We can stay and do just as effective CPR in the field as they can at the emergency department. They will not do any additional skills than what we are doing in the field. So keep that in mind when we are working with CPR patients. So for risk management of the coronavirus, there are some guidelines that have been set up and in place which we need to follow. We want to maintain a distance of 6 feet between us and any other personnel. Most likely the patient and their family, let's maintain that 6 feet. We can have a patient put on a surgical face mask before assessment, which decreases the respiratory droplet threat that they may be posing for us. If life-threatening conditions are not present, consider not transporting. Unnecessary use of the ambulances by infected, stable ambulatory patients quickly depletes our valuable, limited resources and increases the risk of personnel contamination. They can go to the doctor themselves by taking their own vehicle there. There's even telemedicine that they can do to be checked out. Governor Herbert has said in a press conference that ambulance transport services can be denied and personal vehicle is suggested if it is a positive screening for COVID-19. Just because someone is showing signs and symptoms does not mean that we have to transport them. If they're ambulatory and they're stable, they can go to their physician themselves and reduce the number of exposures that are required for it. Now, we want to emphasize as well that if a patient can go by personal vehicle, they should, after they have had a telehealth conversation with the doctor. Now, there are phone numbers that we can hand out to the patients to call to identify whether or not they need to come in and see a doctor, or if they're going to be advised just to stay home and quarantine themselves for a certain amount of time. So passing off and informing the patient is a key factor in a lot of these to decide whether or not the patient needs to be transported. If patient contact is absolutely necessary during a medical call or a fire call, if our services are needed, we need to follow these steps. We will need to be in full PPEs, gowns, gloves, goggles with side shields, an N95 mask, and shoe covers. We're going to limit the exposure time with the patient. Limiting the amount of time that you spend with a patient in close proximity is extremely important. The less exposure means less risk to us. After transporting contaminated patients require complete post-run decontamination of equipment and all interior surfaces of the vehicle, including fire apparatuses. Decontaminate yourself by washing your hands thoroughly, and if any clothing came in contact with patient, those must be decontaminated as well. There's no exact guidelines as far as how to decontaminate clothing. The best way to do it is to throw it in the washing machine with only those clothes. Do not apply any other laundry in there, and use warm hot water to wash them, and also to use the dryer on high heat. Do not wash your clothes with anything else just because you're doing laundry. Only the clothes that are contaminated. Don't bring any contaminated clothing, shoes, or other items, such as your cell phone possibly, home until they have been decontaminated. When returning home from work, take off your shoes and, if possible, remove clothes, shower, and change into a second pair of clean clothing before you enter your home if it's possible. Now, we don't have any showers down at the station for us, so this makes it a little bit more difficult for us to do. So think about having a spare set of clothing in your garage and changing clothing out there, and only handling them by yourself. Don't have your spouse or any other family member handle the clothing that may be contaminated, and place them in the washer. Wipe down the washers after you place them in on the outside surfaces to avoid contamination there. Use warm to hot water when you're washing them, and dry them on high heat as well. So think about what we can do personally to avoid contaminating and spreading this to our families as well. So managing risk when we're responding to a call, we're going to consider a maximum of 4 personnel on the fire apparatus. This reduces the number of personnel, and the number of personnel in the rig will also reduce the number of personnel that can contaminate the rig. We can send out multiple apparatuses with additional manpower if they are needed. It's okay to have 4 in the engine and 4 on the rescue without any problem. Additional personnel can stage in their vehicles until further assistance is requested if it's needed. Once on scene, the contamination threat can be mitigated by proper management and command of the patient encounter. Establishing a safe place to assess the patient, preferably outside, and limiting the number of personnel contacting the patient, preferably only 1, limiting the time spent with the patient, and limiting the amount of medical equipment at the point of care all play a major role in diminishing the overall risk to all first responders. The CD guidelines that have been established for us as first responders are that all public safety employees should refer to Salem City's emergency temporary regulations for clarification concerning exposure to COVID-19. Only employees or citizens in immediate need may enter the fire and EMS station. do not be bringing your families down or your neighbors down to the station because you are bored and have some time. Only fire crews and ambulance crews should be in the station at this time, and we need to limit the number of people down at the station. It's not a place to hang out. It's only a place to respond to if we have a call at this time. There will be no weekly meetings for both ambulance and fire, and no penalty will be assessed because there are no meetings. Supervisors will be communicating any needs that we have with the departments, and for the training, we're going to be conducting training electronically or online by video training similar to this one, or maybe conducted by telemeetings as well. We're looking into possibly doing the telemeetings. The ambulance held one last week, and we may be doing that with the fire as well. Now, all group meetings are suspended until further notice. We will not be meeting as a department. The only time we're going to be getting together is when we see each other on calls. So what happens if you are exposed, whether on a call, at home, out at the store, whatever it may be? If you are exposed to the COVID-19 cases, we need to follow the below steps. For employees of the city, we need to contact your immediate supervisor if you're exposed while on a call. And even if you're not exposed, contact Chief Ely. We need to contact Heather Brindley, as she's going to track your health progress, and inform Chief James of this as well. Supervisors also will ensure contact has been made with Jeff, Heather, and Chief to make sure that the appropriate steps have been taken. So the number one thing is, if you have any type of signs or symptoms of you possibly being sick, you cannot respond to any calls. You must inform Chief Ely or one of the fire captains, and make sure that the city is aware of this as well. So the exposure protocol is, if you have a low, medium, or high exposure incident, you are to do the following. Even if you're wearing PPEs, change your clothes, shoes, and wash them, and be aware of surfaces your clothes or shoes touch, and clean those areas. It may be best to bring a second pair of clothes or shoes to work with you. If you need to, you may go home for those purposes. Now, that doesn't apply so much for the volunteers as it does for the full-time or part-time workers, but you may consider bringing in a second pair of clothing with you in your vehicles and have those ready, so if you do respond to a call, you have them in the vehicle and you can change at the station. Disinfect areas that you have touched or come in contact with before coming back to work. Make sure that you wipe down your personal vehicles, any equipment that you took on scene, and make sure that you're ready for the next call. Watch for any types of signs or symptoms after you've had contact with a person that has been exposed. If you do get symptoms, you need to self-quarantine yourself. You can call the COVID-19 hotline and inform them that you are feeling these symptoms, and they will help walk you through as to whether or not you need to go see a doctor or just remain self-quarantined. They will also advise you if you need to have a test to see if you are positive for the COVID-19. And as you are talking to them on the COVID-19 hotline, you need to let them know that you are a first responder as well. Now, for the additional exposure information, you're going to find a lot more information from the email that Chief Ely sent out on April 1st. This is the directive to all public safety employees. It has additional information that you can read for long-term protocols with the city. Self-quarantine is extremely important if any symptom appears. Even if you only have one of them, you need to self-quarantine yourself to protect the rest of us from the department, as well as the patients, from a possibility of you spreading it to others as well. So the directive also covers what the self-quarantine questions that you need to ask yourselves, as well as guidelines to help protect yourself and your family. One last requirement from the city. Police and EMTs will test their temperatures at the beginning of their shift and will not be allowed to work if the temperature is greater than 100.4. Likewise, if any employee or volunteer has a temperature of 100.4, you are not to come to work or to respond to any calls. Please go home, contact your doctor, follow their directions, and you will be paid for your work hours missed at this, as the temperature is a key indicator of COVID-19 and covered by the employee emergency paid sick leave policy. Make sure your supervisors contact HR, Heather Brindley, and Chief James. Now, as volunteers, we do not get paid unless we respond to a call. So if you have a temperature of 100.4, you are not going to be responding to any calls, which means you will not get paid for that. It's only logical with that. So in summary, COVID-19 is highly contagious and the particles can be volatile for several days. PPEs will protect us against exposure. The PPEs that must be used are thorough hand washing before and after patient contact, the N95 mask for first responders, eye protection, fluid-resistant gowns, gloves. When responding to a call with a possibly infected person, have the patient come outside. Limit the number of people inside the structure and with patient contact, and limit the amount of equipment that goes inside as well. If the patient contact is necessary, all personnel in contact with the patient must be in PPEs. Decontamination of all personnel and equipment must occur after every call before it can respond to another call. If we're in the middle of decontamination and a second call comes in, that apparatus cannot go until it is decontaminated. Decontamination of the apparatus must occur after the call, including the fire apparatus, if any of the personnel came in contact with the patient. The logical approach to managing a major portion of the risks associated with COVID-19 is to use EMS personnel and resources appropriately and at a minimum level with patient contact at this time. So in conclusion, we want to make sure that we're safe and we protect ourselves and those around us by observing and utilizing the guidelines discussed in this presentation. Now, in order to receive credit for this training for your fire hours, you have to make sure that you send me a text with the answers for the following questions. What are the PPE equipments required when coming in contact with an infected patient? Who must follow the city directive for COVID-19? Who can you contact for more information regarding the coronavirus and the policies associated with exposure? And how will a fire training be conducted until further notice? So send me a brief answer with those texts to get the credit for watching this video. And I appreciate you taking out the time to actually watch through it. And the last thing is, if you do have any questions at any time, you can contact myself, Chief Ely, or any of the other fire captains, and we will get the information that you need or clarify anything associated with that. So I appreciate you taking the time again to watch this video, and remember, stay safe, keep your family safe, make sure you're taking the measures to protect yourself and your family and others that you may come in contact with, and we'll see you next time.